Hello, everyone. Thanks so much for joining us today. I'm so pleased to be able to have Eric Steager, the Vice President of Corporate Venture Capital at Anthem, and we're going to be talking about investing in digital health startups. So, Eric, thanks so much for being here. Yeah.
Thank you for having me.
I'm so excited. Please tell the audience a little bit about yourself and your work at Anthem.
Sure. My name is Eric Steager. Recently joined Anthem, the large publicly traded health insurance company, which of course, given the fact that we're publicly traded, I have to put that caveat out there that anything I happen to say is my opinion, not that of the organization. But I am in charge of building our venture capital practice. I joined about 2 years ago from another Blue Cross Blue Shield insurance plan on the East Coast where I helped stand up their venture practice. Prior to that, I was running a venture practice for a family office as well as worked with a public VC. So I've been on the early stage investing side for a number of years. I don't want to say exactly how many because that just dates me. I'm getting old. But it's been a good number of years investing in early stage, particularly digital health companies. So I've certainly seen the evolution from when an EMR was a novel concept and getting no traction whatsoever until mandated usage by the government, all the way through what is becoming a rapid transformation in the current environment. In terms of investment areas, we are strategic investors with financial intentions, meaning we are looking to partner with our existing vendors. Thankfully, our business units are very early stage focused, really looking for cutting edge technology to lower the overall cost and improve the overall care for our members. So we're looking to engage our consumers through technology. We're looking to transform care delivery and make it more mobile and accessible, as well as I noted earlier, try to lower the cost and improve the quality. So those are the basic veins or rivers of thought that we focus on. And early stage investors, so which in basic nomenclature would be Series A or seed investors.
Great. That's I suspect there'll be quite a bit of those in our audience, and I'm sure plenty of them are wondering to learn more about what is it that you are looking for when you're evaluating these kinds of companies, not just healthcare startups generally, but even more specifically behavioral health, if you've got an opinion on that.
The general framework, how to evaluate an early stage company. The biggest question that we always ask first is, what pain are you solving? Have you identified? And I'm thinking very early in the spectrum. We're not talking about Headspace or Calm that are very already developed. They're still early stage, but they're a lot more developed than three gals in a garage trying to come up with an idea. But first and foremost, what pain are you solving? How big is that pain? Is it a big market, a little market, niche market? You can make a very successful company and help a lot of people with a niche market. I don't subscribe to the Silicon Valley. It has to be $1 trillion market. It's an exaggeration, but it doesn't have to be a super big market to be successful. It just makes your life a little bit easier. So what pain are you solving? And then how urgent is that need? A mentor of mine, a friend of mine back in Philadelphia, Steve Barsh from Dream It, coined it, and it was off of a TechCrunch article. Is it an aspirin? Is it a vitamin? Or is it chemotherapy? Meaning, so an aspirin solves an immediate pain. A vitamin may solve the pain later, but chemo is an urgent need and solves a major pain. So you want to kind of orient yourselves around those areas. And clearly the urgent need will drive customer adoption and interest a lot more than a nice to have. And what we're seeing in the COVID environment as we bifurcate and triage our portfolio like a lot of the other investors, you really start to see that demand and adoption shine through, particularly in light of a lot of the non-essential medical conditions being dropped in favor or put on hold for COVID response. You rapidly see what's needed versus not. So again, what pain are you solving? How urgent is that need? And then you start going into the actual models of the business. What's the management team like? What's your moat? So you think about the Game of Thrones castle, the moat around it, for those in the audience who are familiar with that show. But again, that just speaks to the competitive advantage that you may have. What insights do you have that someone else may not have? And I run into a lot of entrepreneurs where they say, look, how can I compete against Google or Facebook or any of the fangs that are out there? And you can come up with a unique insight that they haven't yet, and run with it. But again, keeping in mind what pain you're solving, how big is the market, what's the urgency of the pain that you're trying to solve, are some of the key metrics that we begin to look for. Now, all of that is a very basic institutional investor perspective. We, as Anthem, as strategic investors, have an additional criteria, if you will, around how strategic is it. And I'm trying to find the needle in the haystack, if you will. It's just because it's strategic doesn't mean it's a good venture deal. Just because it's a good venture deal doesn't mean it's strategic. So we are really looking at the intersection, the Venn diagram of those two areas. And what strategic means is different for each business unit, but it certainly involves a whole lot of conversations to understand what their pain points are. And again, as I noted earlier, there have been some corporations, and I've been in corporate venture capital almost a decade now. So you talk to folks in the industry, some business units are forward thinking, some are not. Some are very operationally oriented, and you ask them what pain they're trying to solve for, and they ask if they're hungry. Well, in terms of immediacy, they're like, okay, I'm thinking 3 hours ahead versus Horizon 2, Horizon 3. So each company and corporation is different. So knowing your audience as a startup and what type of culture the organization that you're pitching to or trying to present to certainly helps.
That's super helpful. And on that line of thinking, for startups looking to receive an investment from somebody like an Anthem, is it recommended that they're already a vendor or not necessarily?
Great question. And each corporate venture capital organization is different. Some of my friends and brethren, they can invest, and then they have an entire team dedicated in-house dedicated to bringing their portfolio and selling into the organization. That's difficult because you're still dealing with the 18-month sales cycle into a 12 to 18-month sales cycle for large health systems or payers. For our firm, specifically, they have to be a vendor or it's a successful pilot looking to scale. Yeah. But again, it goes back to understanding your audience and who you're speaking to. And that is one of the first questions a startup should be asking to a corporate VC would be, what is your business development model? Do I have to have the vendor for relationship first, which takes a longer time period, but once I'm an investor, I'm actually already bringing revenue versus the promise of bringing revenue.
Mm-hmm. Totally. And that whole thing about, promise of bringing revenue, I feel like a lot of startups think that, if they receive some kind of investment from some corporation, that necessarily it means that they're going to become a vendor, and It's not quite so easy. Is that the case?
That is exactly the case. It's not so easy. You're still subject to the same long sales cycle. You're still subject to trying to sell your value proposition to the company's business unit that may or may not be familiar. Again, several folks I know have very deep diligence process ahead of the investment, so they already know what the business unit is thinking. Again, so that's another question for startups to ask the investor. Excuse me.
Yep.
And when you're thinking about it, I'm interviewing the company, but they're interviewing me just as much. It's a two-way street. And as you take an investment from either institutional or corporate VC, it's like a marriage. You're dating, you get engaged, it would be the term sheet, and then ultimately I'm spending 7 to 10 years with this organization.
As an entrepreneur, if I'm looking to fundraise for my next round and I'm interested in having a few strategic investors along with traditionals, what should I keep in mind?
Oh, that's a big question. But again, it goes back to the earlier point where I was saying you're interviewing us as much as we're interviewing you. What are we bringing to the table? How quickly can we move? How involved is the strategic going to be? So here's some other best practices around who do they have a board seat? Do they have a board observer seat? Who is going to fill that role? A corporate venture tends to get itself into trouble because they'll put a business unit executive who may or may not be familiar with early stage investing. It's a different skill set. It's not the charity board that they may be used to being on that involves a golf outing and a couple dinners over the year. This is weekly to monthly management calls. This is being actively involved. So what is the expectation of who takes the board seat? What can they bring? So again, I'm starting with and I've put to the side the question of, will you bring revenue? Is there a relationship? And again, in our case, it's yes, we will, because you're already a successful pilot looking to scale or already an early stage vendor. But other things to think about, are they asking for non-market terms? Some institutional venture firms don't like strategics, in all candor. And there was a big pushback a couple of years ago against it because some of, I'll say more inexperienced firms would ask for non-market terms. We functionally act as an institutional investor in terms of we look to partner with an institutional investor as part of our round. We look to take a board seat or a board observer, but it's filled by those that have experience in early stage investing to remove any conflicts of interest. But again, to bring the most relevant talent to the CEO and their management team.
Mm-hmm. Great. Yep. From a health plan's perspective, do you have any preference for if the startups you're evaluating are direct to consumer versus direct to consumer versus B2B?
So in terms of preference of business model, we don't. Again, the direct to consumer model for a large health insurance company may be more difficult. We're more in the practice of a B2B2C. So as an example, if you're looking at, in light of COVID, a telemedicine investment or a mobile symptom checker, we're not doing infomercials and we're not advertising XYZ technology company is doing this, therefore you need to call 1-800 I'm sick. Flip side would be, we are looking for something that will be gaining traction or will be adopted by ultimately the consumer, and how is it used.
Mm-hmm. So Eric, I have to ask, all these startups that are looking to gain traction in the behavioral health space, a question that always comes up is, how do we navigate reimbursement? Any advice?
Quite a number, but I'll keep it at a high level. So there's two things to think about. What's our business model and how do we get paid? But time is your most finite resource as an entrepreneur. So we can, and I've seen a lot, and it isn't just behavioral health. It can be diagnostics. It can be digital health. But everyone says, oh, once I get a code, then it's the field of dreams mentality. I get a code, doctors will use it. And I always talk to startups and they're like, no, the field of dreams doesn't work. You really need to prove your value prop, because if you think about it, well, a lot of private insurance companies tend to follow CMS. So there's just starting point. But you can spend 10 meetings with 10 different insurance companies all having the same conversation, and the 12 to 18 to 24 month timetable to get the necessary data, to show it to the medical directors, to enhance medical policy, to come up with an individual or a new code. Like, this is a long process. And I'll go back to the earlier point of time is your most finite resource. So where could you spend your time the best? Is it out there actually trying to get validated data, and we'll figure out the reimbursement strategy later? I've seen that work more often than I have let me go talk to 18 different insurance companies and hope for a code, because you still haven't solved for the adoption problem. So the best stage advice for an early company, in my opinion, would be focus on proving what's the data. Validate that someone will use it. That will generate meaningful use and insights, and then you can come back and ask for a code. The other would be, are you doing something that already has a code in place? Maybe you don't need a unique code. Depending on the codes that are out there, the code could be broad enough that you could legitimately and authentically be incorporated in that. Now, the flip side of that is, well, then you're not doing are you doing anything really different? Because remember how we were talking about earlier about the moat, what's your competitive advantage? How are you different? What pain are you solving? Well, if you're solving the same pain that everybody else is, and this is where, if you look at the resilience space, there's a whole lot of meditation apps out there. We don't need another take 5 minutes, pause and breathe app that's out there. That's been done. So it really is that fine balance of understanding the uniqueness of your process, your model, your solution, coupled with, are there available reimbursement paths in existence today? But I would not spend a whole lot of time initially up front with not necessarily health insurance, but even health systems trying to understand, how do we get paid for it? Prove your value, get the data, and the reimbursement strategy will become the shining light.
That's great advice. Yeah, if it's really novel, then you're going to have to find a business model that doesn't rely on reimbursement upfront, potentially, because just the time is.
And that's the biggest statement. Like, how do you survive without a reimbursement code or a unique one? And the ones that are successful are able to raise some capital up front, and depending on your stage, it could be the friends, family round for a seed, or it could be an early stage company. It's time consuming. It's difficult to raise capital, but there's a vetting process as part of that will help you refine what you're doing, your business model, how you're thinking about things.
Mm-hmm. Right. And this is just even talking digital health, when we add new things like some of the digital therapeutics or beyond that need clinical trials or FDA. That's a whole other ballpark.
Yeah, several years ago, there was a digital therapeutic that was they were hoping to be prescribed by physicians. They raised over $100 million because they had to do the clinical trials. Now, this is a few years ago, but that's a lot of money to raise versus nowadays. But again, the same concept is, whether it's in the resilience space all the way through depression, through addiction, and again, I'm just only speaking for the behavioral side, finding a model that works, getting actual adoption of it is imperative. And call it lean startup methodology to go back a few years, but get in the market, get some data, iterate before what I've seen a lot of entrepreneurs come to us and say, oh, here's a great idea. Would you reimburse it and give us a new code? I'm like, where's the data? Because as soon as I go to my medical policy team, that's the question they're going to ask me. Does it work? And if I can't answer that to a physician or a medical policy director's satisfaction, that was effectively a wasted X number of months of the entrepreneur's time, and I'm trying to be respectful of theirs. So,
right. Great advice. So we only have a couple minutes left, but I have to ask, in the midst of coronavirus, how do you think that's impacting investing in digital health startups?
It's not making it easier. No, here's the thing. As I alluded to earlier, been in the space a few years. I've seen this is the third downturn, and you start to see history may not exactly repeat, but sure the heck rhymes. So you're starting to see the first 3 to 6 months of entrepreneurs holding on to prior terms and valuations. We would imagine probably in the next 3 to 4 months, we'll start seeing a capitulation on the entrepreneur side, and terms may start changing. Valuations may start changing. The challenge is we haven't had, as much as I said, we have had 2 downturns in my career. We haven't had anything like this since, 20% unemployment rate since the Great Depression. So that's why I said it may rhyme, but we're not entirely sure. But investing in early stage companies, some of the best companies have been built in a downturn. So to the entrepreneurs present, just because it's difficult doesn't mean it's impossible. And entrepreneurs by nature are optimistic. So keep dreaming, keep working at it. It's just recognize that the capital that was available and awash in the market several months ago may not be there. Terms may change. It may take more time, but it's still possible.
Mm-hmm. Exactly. Well, Eric, this is wonderful, super helpful. I'm sure the audience really appreciates the advice as much as I have, and thanks so much for joining us.
No, I appreciate it. Thank you for having me.